So if you see this beautiful girl, we know that she's so beautiful because Dr. Nyamutsu talked about the divine proportion divine. And we can see that this girl has that kind of proportion. And also she has the aesthetic concept of the beauty. In the nose, if we can see the nose, of the lips, or the chin, or the brow, she has the concept of the beauty. So that's why she's so beautiful. But what happens if she loses something, okay? Something, and talking about the harmony of the face, talking about the bone structures, or cartilage, or soft tissues as a muscle, fascia, or fat, or the skin. What happens if one patient loses a lot of fat in the face? So we have this very good actor, Christian Bale. One picture is from Batman, and the other is from Psycho. And the director of the movie told him that he needs to lose a lot of weight. So during 6 months, during 6 weeks, I mean, he loses a lot of pounds. And because he's very professional, you can see this handsome man without any fat, and also he lost also muscle. So he doesn't handsome anymore. As a matter of fact, he looks sick, like the director wants. And he looks also ugly instead of handsome. What happened with the woman? The woman always thinks that if they are thin, they look like a model. So she's one of the she's the wife of one of the best soccer players in the world, David Beckham. But she always tried to look like a model, and she tried to lose all the weight. And as for me, this is more beauty with her own fat that she's trying to lose all the fat. She looks like a sick person. So she looks like not nice as with her own fat. And what happened with the opposite? The opposite, the patient don't look ugly or don't look sick. The patient will look funny or will look like a child when he gained a lot of fat in the face. This is a patient for our clinic. So one of the doctors who works in the clinic put the gastric lap band. So he loses a lot of pounds, and I think that he looks better, but he's in the last 50s, so maybe he needs a facelift or eyelids, because he loses volume, but also the gravity, it doesn't work very well. Sometimes happen with the liposuction, so we need to explain our patients, if they decide liposuction, that they can look like this girl. She wants liposuction in the face and in the neck, and she doesn't look too much better. Maybe she improved the 20% or 30%. But I explained her before, if she wants to look better, she needs the facelift and the eyelids, and now she looks much better after the liposuction and the facelift. This is the first time that she came with me. So sometimes, especially when the patient has excess of skin or the age, we can help with the liposuction and also with the facelift and other procedures. It's different with the young people. This is another patient from the clinic with the gastric lap band. And if you see, she's young. So if she loses weight, or if we do liposuction in the face and in the neck, all the tissues go back. So she's an excellent patient to reduce fat, and then she looks very nice. With a lot of fat, she doesn't look ugly or sick, but she looks funny. So we need to talk about this with the patients. And if this is the same patient, but look, all the tissues, because he is young, is go back. If you see this excess of the skin and maybe the fascia, something, it's go back just with the because he is young. So this is the same patient. And he was in our clinic and looked with excess of fat in the face and with anything of the fat in the face. It's the same patient. Maybe at this moment, if we do liposuction, maybe chin implant, he will improve. But he is still losing weight and he doesn't look nice. Then what happens with the age? These three factors always help you. It doesn't matter what happened. The first factor is the photoaging, damage in the skin. So we need to do something as a cosmetic surgery. The other factor is the gravity. So all the tissues go down, and they are sagging. And the last is the volume. So if you can handle all of those problems, you will improve always their face. So if you see these 20 years, 30 years in compared with this, they are very, very different. And also the fat, it's a very important factor, and we can work the fat in those patients. And we need to explain when we work with those patients that if they take care about the food, about the exercise, about the skin, for a long, long time, your job, it will look very, very good. And I put this example. This is Salma Hayek when she was 20 years. And she is 40 years old. 20 years more. Okay? She's old, but she's so pretty. As a matter of fact, better than 20 years old. Okay? Because she takes care of all that food and exercise and skin. So if you do something in young person, is our responsibility, or is we should advise this to our patients that they are very happy. And some of them listen to you. So it's important. She's 42 years, 19 years old, one daughter, and she's still very, very pretty. And now let's go to talk a little bit about the anatomy. And if you put all the fat together from the head and the neck, the 80% it will be in the head, the 20% in the neck. And this is very important because I'm going to explain you why. And if all the fat in the face, the 60% is under the skin, and the other 40% is under the fascia. Okay, so this is very important because one is liposuction and one is transfer of the fat. And it's not, I'm going to transfer deep, or where are you going to transfer? Where are you going to do the liposuction? It's not just deep. It's, you need to know the anatomy and to know where you are going to put the fat or to do liposuction. And honestly, it's the difference. It's big difference. Then, this is a section that we are going to do in this section. And this is the skin. This is fat under the skin. This is the fascia, and this is more fat. Always the liposuction in the face is above the fascia, in this mass, in the face, or above the platysma, but never under. What about the transfer fat? You can transfer fat in any place. Depends what your patients need and where your patients need to transfer fat. So it's not the same plane to liposuction that to transfer fat. Okay, then always the liposuction is under the skin and above this mass, and in the neck is under the skin and above the platysma. If you see these two girls, they are almost the same age. She's one of my assistants, she's so pretty, she's over there, right, Racelita? To me, she's so pretty because she has the fat in the right position. What about my patient? She doesn't look too nice, okay? But if we put just a few drops of fat under the skin, just under the skin, she will improve a lot. maybe she needs more, okay? And one thing, the liposuction is in just some areas. I'm going to explain you later. But the fat, you can transfer fat here, 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 in any place. Talking about the face, just the face, just the face. To transfer fat is just in the face, never in the neck. Okay, in the neck is just liposuction. So this is the big difference. And one is just to drop fat under the skin, but what about the volume? You can transfer volume also, not just drops of fat. So she needs in this area fat. So I can transfer volume of fat and she improve more. Look at this. Okay, so this patient came with me just for the nose surgery, but you are a cosmetic surgeon. You need to study the face of the patient. So I studied the face and I explained her, okay, it's better if I put the chin implant, if I do the liposuction here, and if I transfer fat, because it's my job. Okay, and sometimes the patient accept, and it's not the same to transfer fat under the skin, to transfer fat in different levels. Okay, and you can transfer volumes if you want also. This is a patient that I did facelift like 8 years ago. She came with me because she still looked tired, and just transfer fat in the face and do liposuction in the neck, and she improved a little bit more. She is 58 years old. And always the cosmetic surgeon needs to do the surgery that nobody can see that you do surgery in the patient. That is the difference in cosmetic surgery. We do surgeries, but nobody can see the surgery. Okay? It's very important. If you see this girl, she doesn't look like eyelids, facelift, transfer of fat, liposuction in the neck. It's very important. Now, I'm going to talk because just about my topic, that is the liposuction in the face and in the neck. Then, always the models and the young girls and the beautiful girls are the goal. Okay? In the neck, we need to remove the most fat that you can. You can see any model with fat there. You can see any model, any young people with fat in this area. Okay? And if you see this picture just in the neck, I can see the structures. Any anatomic surgeon can see the jugular vein, the sternocleidomastoideo, the salivary gland. And if we have, before that, we have the skin, the fat, and the muscle, platysmal muscle. But this muscle is very thin, sometimes thinner than the skin. That's why we can see the structures there. So why I need to let the fat here? We need to remove all the fat. Depends the patient, but if the patient is young, remove all the fat. Because in the young people, nice girls, model girls, misses, they don't have fat here. Okay? And it's above the platysma, remember that. Why? Because under the platysma we have these structures that we need to protect. Okay? And in the face we have these structures, especially the facial nerve that we can damage or we can irritate. It's no big deal. This surgery, liposuction, is very, very safe. And we need to remove this fat just under the skin. What is the goal? Is to remove fat accumulation from the face and neck in some areas with the assistance of cannulas, syringe, and suction machine. And I'm going to tell you when you use the suction machine, when you use the syringe. I almost doing this procedure for almost 20-something years old. And I have a problem, so now I'm going to tell you when you use syringe, when you use the liposuction, and you will work very, very safe. And where those fat accumulate in the face, just 3 areas. It's different from to transfer fat, like I told you before. Just you can remove fat in the face in 3 areas. The cheek, the submaxillary region, in the United States you say jowl area. That is the lower part of the cheek, but this is the jowl area. And the other is the parotid area. Okay, those are the areas that I can do liposuction. And in the